Hello, my name is Michael. I'm an FMP student, and your name is Tatiana Wiseman.
Yes,
May I address you by Tatiana?
correct.
Thank you. Um, First identifier, your birth date is 12/9/75.
Yes,
Thank you. And, excuse me. First, I'm going to perform an abdominal assessment on you today. Is that okay?
yes.
All right, I'm just going to go wash my hands.
Okay.
All right. First, I'm going to do inspection of your abdomen. Can I have you lie down, please?
Yes.
First, I'm going to be inspecting the skin of your abdomen. And what I'm looking for is areas of discoloration. I'm looking for any scarring or any lesions or nodules. And I'm going to check the temperature, which would be a sign of a local infection. And everything looks good. Next, I'm going to check the contour of your abdomen. And I'm assessing for symmetry. Also, I am looking for protuberance, and also I'm looking for scaphoid, which would indicate if a patient was malnutrition. And your abdomen looks flat within normal limits. And also I would be inspecting for your umbilicus and see if it was bulging, which would probably indicate a hernia. Next, I am going to assess your aorta, and I'm going to be assessing your renal arteries, your iliac arteries, and your femoral arteries. I'll be assessing for bruits, and I'll be using the bell of my stethoscope. Checking the renal arteries, iliac arteries, and the femoral arteries. And I hear no bruise. If I did, would indicate a possible aneurysm or arterial stenosis. Next, I'll be listening to your bowel sounds. Is that okay?
Yes.
All right. I'm going to start with the left lower quadrant. And bowel sounds usually emit 5 to 34 per minute, or that's one bowel sound every 5 to 10 seconds. And I heard a bowel sound. Bowel sound. This is the right upper quadrant, or left upper quadrant, excuse me. And then your left lower quadrant. You have positive bowel signs to all quadrants, and they're within normal limits. Normal sounds. Next, I'm gonna gently, I'm gonna palpate your stomach, your abdomen. I'm gonna do some gentle palpation, and then I'm gonna do some deep palpation. And we're looking for areas of tenderness and abdominal mass. So first, is there any pain to that?
No.
At all? No pain. I do deep palpation. And no tender spots to her abdomen or no areas of mass. Next, I'm going to assess, I'm going to estimate the size of her liver using the right mid-clavicular line. And I'm going to use a tympani to assess the size of it. And I'm going to start at the top of her lung, right here in her right upper chest. And what we're hearing is renaissance until we hear an area of dullness, which would be the top part of her liver. And there we go. That's just, I'm hearing the dullness right here. Now I'm going to locate the area of her the lower border of her liver, and I'm going to start at the right lower quadrant, and I'm going to percuss all the way up until I hear an area of dullness. And I've heard the dullness, and what I have right here is an area of 6 to 12 centimeters, which is within normal limits of her liver and the size. Next, I'm gonna palpate and assess for the lower border of her liver, and I'm gonna use the right costal margin, and I'm gonna have the patient inhale while I locate the area right here. Take a deep breath, please. And I am feeling the lower border of her liver, which is firm. I do not feel any nodules, and it's soft. Next, I'm gonna palpate her spleen, and I'm gonna reach across with my left hand and put that behind her, and I'm gonna go over to the left costal margin and palpate in. And I don't feel the spleen. Again, approximately 5% of normal adults, you're able to palpate the spleen tip. All right. Next, I'm going to palpate the aorta, and we're looking for, we're trying to rule out an aneurysm. And that's a negative. I do not feel, there's no sounds as resulting as far as the symptoms of an aneurysm. Next, I'm going to palpate the lymph nodes to her inguinal and her femoral lymph nodes. And we have 3 lymph nodes right here. Is there any pain to that area?
No.
Again, if these were painful or swollen, that would indicate a possible systemic infection to her body. All right, thank you for that. Next, I'm going to percuss her abdomen, and we're going to hear areas of that hollow sound. You hear that everywhere. Start again over here, her right lower quadrant, up to her upper right quadrant, over to her left quadrant. And I did hear tympani, no areas of, I didn't hear any dullness throughout. Next, I'm gonna assess her spleen. I'm gonna percuss her spleen to rule out enlargement of that area, and I'm going to percuss from her left lower chest, almost at her sixth rib, down to her mid axillary line, and down to her costal margin. And we should have tympani to this whole area. And if we did have dullness, that would indicate an enlarged spleen. All right. Thank you for that. Next, we're going to assess for cholecystitis using a Murphy sign. And I'm going to come over here and I'm going to ask the patient to take a deep breath as I push in. Is there any pain there?
No.
All right, that's a negative on Murphy's sign. No problems with her gallbladder. Next, we're gonna assess for peritoneal, ruling out problems with her appendix. And first, we're gonna start with her McBurney's point, which is located at her anterior superior iliac spine, 1/3 the way to her umbilicus. So I'm going to locate that, and that's probably 1/3 of the way, and I'm going to palpate that. And are you experiencing any tenderness or any
No.
pain?
No.
Next, I'm going to perform a rebound test, which is a classic sign of appendicitis. If she has that pain when I let it go, and do you have any pain there?
No.
Next, I'm going to perform the SOSAS test, and that's going to be another indicator if the patient is experiencing appendicitis. And I'm going to have the patient bring her leg up. I'm pulling resistance. Is there any pain you're having to your right lower quadrant? Again, that psoas muscle would be flexed and would be applying pressure to an inflamed appendix, which would cause the patient some pain, and that was a negative on that. Next, we're going to do the alterator test, and I'm going to have the patient roll over to her left side. And then I'm going to take her leg, flex the hip and the knee, and rotate that inward. Is there any pain?
No.
Again, thank you for that. Now again, there was some tension, there's some tension placed onto the alterator muscle, which would probably more than likely rub against that inflamed appendix, causing her pain to her right lower quadrant. And finally, we're going to do the Rawlsing's test, and that I'm going to apply some pressure to the left lower quadrant, and she's going to experience, if she did have appendicitis, that would emit some referred pain to her right lower quadrant. And I'm going to step over here and do that. Excuse me. Do you have any pain?
No.
All right. She has no pain to the Rawlsing sign. So that completes our abdominal assessment for this patient. Do you have any questions for me?
No.
All right, thank you.